Today in this session we are discussing about the principles of bed making procedures. There are four main principles for this. For these principles, what we can do, we will also discuss that. Microorganisms are found everywhere on the skin, on the articles used by the client and in the environment. The nurse takes care to prevent the transference of microorganisms from the source to the new host by direct and indirect contact or prevent the multiplication of microorganisms. The nurse washes her hands before and after bed making to protect the client and herself from cross infection. Bed clothes are changed frequently to ensure cleanliness. When removing the bed linen, care to be taken not to drop them on the floor. Shake the linen and gently to remove the dust. Flapping the bed clothes cause air motion and thus cause transference of bacteria along with the dust. Linen should be folded and held away from the nose to prevent direct contact with microorganisms. Dusting and thorough cleaning of the client's bed and the unit daily and on the discharge of the client keep them free from dust and microorganisms. Soap, water, air and sunshine will help them to be clean. Dry dusting raises dust. Damp dusting is recommended. Since the mattresses, pillows, blankets and rubber sheets are not washed and sterilized ordinarily, the client are protected from contact with them by washable covers. The nurse keeps a reasonable distance from the client's face to prevent droplet infection.
If the patient is unconscious.
Cleaning an area where there are less number of organisms before cleaning an area where there are numerous organisms minimize the spread of organisms to the clean area. The linen removed from the isolation unit is disinfected first before they are sent to laundry. Nurses having respiratory infection should not attend to the clients. The second principle is a safe and comfortable bed will ensure rest, sleep and prevent several complications in bedridden clients, for example, bed sore, foot drop, etc. The body exerts uneven pressure against mattresses. The pressure is greatest over the bony prominences. Lumps increases in the bed can cause bed sore due to friction between the skin and the mattresses or wrinkled sheets. Therefore, the note should be take care to make the bed smooth and unwrinkled. Pull the bottom sheet tightly so that there are no wrinkles. The linen is tucked far enough under the mattress. Keep it fixed, tight and smooth. It is tucked in one side and tightened. Then it is tucked in on the opposite side. While tightening the seat, do not change the shape of mattress. The mattress should remain flat and even with the corners firm and square. If lumps are present in the mattress due to the collection of cotton in any area, it should be made smooth before making the bed. Otherwise, it will be source of discomfort for the client.
To buy this type of cotton mattress because
Turning the mattress and pillows keeps them aired, thus keeping them fresh and soft. No wet linen should remain on the bed. Daily dusting should be done to remove any peelings or seeds that are adhered to the bed linen of the bedridden client, which may cause discomfort to the client. If the client is in bed for a long time, right upper bedding may cause foot drops. Any one of the several measures may be used to prevent bed linen tights over the foot. Make a plate in the top sheet and blanket across the foot of the bed. This we can do. First option. Make a longitudinal box plate down the middle of the bed. While taking the upper bedding, ask the client to flex his legs. Place a pillow, footboard or cradle at the foot of the bed to take weight of the upper bedding. Bed made for a client should allow enough freedom for moving side to side. Movement of the client stimulates circulation, prevents bed sore and maintain muscle tone. The third principle is good body mechanisms maintain the body alignment and prevent fatigue. For that, what we can do? The stability of the body is assured by keeping its center of the gravity over its base. When the base is wide, it ensures that center of gravity will fall through its base. In standing position, the nurse can have wide base by separating her feet. The nearer to the center of gravity away it is held, the less is this strain produced. For example, when opening the linen, it should be placed on the edge of the bed rather than holding it about the shoulder level. When tucking the sheets under the mattress, flexing is done by knees and hips. This position shifts the work to the long and strong muscles of the thigh and keeps the back in good alignment. This reduces strain on the back. When placing the linen on the bed and tucking them under the mattress, face the direction of the work and move with the work rather than twisting the body and overreaching.
Remove the pillowcase and leave it on the bed. Place the pillow.
The next principle, fourth one, as systematic ways of functioning, saves time, energy, and material. For this principle, we have to assemble our articles and arrange them conveniently before starting the bed making. Arrange the linen in the reverse order of use. Finish on one side of the bed before going to the opposite side.
As I remove it, I'm rolling it up onto itself.
When sweeping the bed, remove the bed linen one by one, holding the open end towards the floor so that clients' possessions and hospital articles are not sent to the laundry.
Foot of the bed. Remove the bedspread and blankets separately. If they are soiled, place them in the linen bag. If either is to be reused, fold into a square.
The bed sheets are folded in such a way that it can be replaced easily.
Ahead and unsecure the fitted sheet.